Good afternoon, everyone, and welcome to our 15th QPS Talk Time of the year. Today, we're going to be talking about hospice-friendly hospitals and QI approaches to improve end-of-life care. You're all very welcome. And if you're not already doing so, really would encourage you to follow us on social media. So you can check us out on Twitter, and we're on LinkedIn now as well. So today's session is about hospice-friendly hospitals, and we're going to hear about the Hospice Friendly Hospital Programme and their Quality Improvement Awards with examples of previous attendees, hear about award-winning QI project Together in Sympathy book at the Mercy University Hospital in Cork. And then we're going to hear from our panel, who Roisin is going to introduce to you now, and we're going to have a chance for some Q&A at the end, where we'll get to put some of your questions to the panel. So Roisin, I'm going to hand over to you.
Great, thanks so much, John. You're all very welcome today. I'm really delighted to be co-hosting today's QPS Talk Time with John. I know I've been working with two of our first speakers, Alice Anderson and Lucy Andrews, from the Irish Hospice Foundation and the Hospice Friendly Hospitals Programme for the last number of months. And despite my work in QI and patient safety for the last number of years, I've never encountered such humbling, patient-centered QI work as I have in hospice and palliative care and end-of-life care. And I really hope that you all get a glimpse of that today as well through the presentations that you'll hear. So we have Alice and Lucy joining us from the Irish Hospice Foundation. They'll tell you a little bit more about the Hospice Friendly Hospitals Programme, their QI award scheme, and the general work that they do. And we also have Edel O'Neill, who's joining us from the Mercy University Hospital in Cork, to tell us about her QI project and the QI award that the project received. So I will, without further ado, as they say, I will hand you over to Alice to tell us a bit more about the Hospice Friendly Hospitals Programme.
Thank you so much, Roisin, and thank you to everyone on the QPS Talk Time podcast for inviting us here today. I know myself and Lucy are really excited to be here and to be able to share this with you. So very briefly, I'm going to take us through some of the broader context of who Irish Hospice Foundation are and what the Hospice Friendly Hospitals Programme is doing, and then I'll be handing over to Lucy, and Lucy will take you into the QI awards in more detail. So if I go on to the first slide, I'll just tell you a little bit about Irish Hospice Foundation. It is the national charity on death, dying and bereavement here in Ireland. And our vision is an Ireland where people experience death, dying and bereavement are provided with the care and the support they need. And we're doing this by working towards best end-of-life care and bereavement care for all. So on the next slide, I'll say, why are we doing this? Well, 35,000 people on average die every year in Ireland. These stats are from 2022. And that means that 100 people are dying a day. And what we know is that there can be up to 10 people significantly impacted and bereaved for every one death. And that means that in Ireland every year, we have an additional 350,000 people grieving. So the impact is real, the impact is far reaching. And in Irish Hospice Foundation, we're really looking at what we can do across the settings and across the services. So on the next slide, we just present the data from the 2018 census, and it just tells you a little bit about where people are dying. So we can see that hospitals still have the greatest proportion of end-of-life care, with 44% of people experiencing end-of-life care and dying within a hospital. 23% of deaths are accounted for in both the nursing homes and the homes, and then hospices and elsewhere make up the rest of the proportion. So we can see the end of life is happening everywhere and what we can do about it. Before I move on to tell you a little bit more about the Irish Hospice Foundation programmes, I just wanted to briefly touch upon the bereavement support line. So this is a line that we run from Irish Hospice Foundation, and it's available to you as professionals for both your professional and your personal needs. It's a free support line, and I would just love to share it with you and for you to share it with anybody else who you think might find it useful. It's available on Monday to Friday, 10 to 1 p.m. and we just want to keep signposting this and keep letting people know about this. On the next slide, I wanted to mention our healthcare programme. So we just saw there the data about where people are dying. So in Irish Hospice Foundation, we have 3 healthcare programmes that are matched to each setting. We have Hospice Friendly Hospitals, which have been in existence since 2006. The Carew Nursing Home Programme, We had a previous program as well, so we've been working in nursing homes for quite a while now, but the Carew program was launched this year, and the Dying Well at Home program. Again, additionally, we have other pieces of work behind Dying Well at Home, but there's a new program of work coming out this year and into next year. All of these programs are run in partnership, and that's a really important element of the work to us. We're not doing this by ourselves. We're doing this in partnership, and particularly Hospice Friendly Hospitals. It's run in partnership with the HSE. Before I move on, I want to mention the purple spiral in the top. This symbol was created for the Hospice Friendly Hospitals Programme. Of course, it's coming from the Celtic history in Ireland, and the idea behind this symbol is to really signify what's happening. For us, it's in a hospital setting, but it's also being used in the nursing homes and in other settings. And it's to say that there's a significant moment of death or dying happening for a family, for a patient, and for the staff in that area. And so it's always great just to use these opportunities to explain that and to also signpost what that symbol means for us. In Irish Hospice Foundation, we're not just the healthcare programs, we're also the education team. So our education team have a master's in grief and loss, but there's also the Children in Loss program and many one-day workshops. So just say there's a huge education resource there. We've all our leaflets and printed resources, particularly around bereavement and grief. And then we work in partnership across our programs with our communications teams, the arts program, and our fundraising colleagues as well, which without them a lot of this work wouldn't happen. Just on the final slide, I'll just tell you a little bit more about Hospice Friendly Hospitals Programme. So the aim of the programme is to develop the capacity in hospitals to meet the quality care standards for end-of-life care and to improve that culture of care in a hospital setting in relation to all aspects of dying, death and bereavement. And we're working alongside the palliative care model of care to ensure that every person is met with the need, with the palliative care level appropriate to their needs. In the hexagon, we have our 6 domains of what the Hospice Friendly Hospital Programme is. So it's governance and leadership. We do this through a joint oversight group with the HSE, and we run 4 national networks. Then QI, audit and research, obviously this sits within that bubble a little bit, but it's also about how we survey what's happening, how we audit what's going on in the hospitals, and how we can make improvements. Under education and training, I hope some of you are familiar with Final Journeys. We're delighted that we've just launched Final Journeys for the paediatric settings, and we're working on a couple other programs at the moment as well. Improving the hospital environment, some of you might know Design and Dignity. That's a huge piece of work that we are undertaking to improve the physical environments within hospitals that are dedicated towards end-of-life care. Advocacy, we do that with our colleagues in the hospitals and also our advocacy team in Irish Hospice Foundation. And that's probably concurrent and underlying everything that we're doing. We're always advocating for more services and expressing the needs that we see. And then practical resources, just to let you know that there are a wide range of practical resources and you can find out more about them through the Hospice Friendly Hospitals website page. And one of the practical resources that we provide are the Hospice Friendly Hospital grants. And so to take you through those grants and what they really mean, I'm going to hand over to Lucy. And I know that was a whistle stop through HFH and the IHF, but I'm open to questions at the end as well. So thank you so much for having me. And yeah, over to Lucy to tell you more about the QI Awards. Thank you.
Thanks, Alice, and thanks everyone on the webinar today. My name's Lucy and I'm the Development Officer on the Hospice Friendly Hospitals Programme. And I'll be spending the next 10 minutes talking about what the QI Awards are, sharing previous QI projects, and discussing our intentions for the coming years. So, before we get started, I wanted to give you an idea of some of the wonderful initiatives and improvement projects that have been supported through the Hospice Friendly Hospitals Quality Improvement Awards. So I've included some images of completed projects from 2022. Firstly, we have the Care After Death Checklist. This project was led by End-of-Life Care Coordinator Rebecca Lloyd and co-applicants within University Hospital Limerick. The Care After Death Checklist includes all forms needed for completion to ensure homogeneous delivery of care for patients during the dying phase and after they have died in the hospital. The checklist allows everyone who works in care after death to consistently deliver excellence in care after death, reduce exceptions, and improve communication with the bereaved. In the middle, we've got the project, which is Grief in the ICU, Bereavement Support for Children. This project, led by Paddy Cahill in St Luke's Hospital, Kilkenny, and this project aims to meet the individual needs of children who experience the loss of a loved one in the ICU setting. This pack acts as a resource for family members to help the child navigate their way through grief in the time after death. And there's 3 packs, and these are categorized by age and have age-appropriate resources. So there's the under 6, the 6 to 12, and 12 years and above. And then the final project that we're showcasing here is the Thinking of You memory box. This project led by organ donation nurse manager Gillian Shahan and co-applicants at Galway University Hospital. This beautiful project is used to initiate memory making service for families of potential and considered organ donors in intensive care units throughout the Salter University Healthcare Group. And the objective is to provide a memory box to those tragically bereaved families undergoing the organ donation process. So we are delighted to support such person-centred projects that help to improve end-of-life care within these acute hospital settings. And unfortunately, due to limitations on time, we're only able to showcase 3 of the 10 projects supported through the QI Awards in 2022. However, if you want to view the other 7 QI awardees and also to hear the lead applicants speak to their experience of these 3 projects shown, you can do so by jumping onto our website. And I believe the links will be posted in the chat after this session. Okay, so what are the HFH QI Awards? Well, each year we're able to recognise projects that will improve end-of-life care for patients, the family, staff and the hospital. Firstly, there are financial support of up to €1,000 for applicants to support their quality improvement project. And these awards are delivered in partnership with the HSE National Quality and Patient Safety Directive, and funding for the awards is made possible as part of the IHF's ongoing partnership with the HSE. Next, the awards encourage applicants to look at current ways of working. They encourage people to ask, what are we doing that we could be doing better, and what would we like to accomplish? Next, they use a robust quality improvement approach to make these changes. For example, how would we know that a change is an improvement or a change for change's sake? They shine a light on improved ways of providing person-centred end-of-life care, and they explore innovation and creative ways to improve the way that healthcare professionals work. So by asking, how can we make the change? And then lastly, they raise awareness of how QI methods can be used to make end-of-life care better. So next, we're just going to have a little look at some statistics. So the awards launched in 2019, and since its inception, we've received a total of 101 applications, and we've awarded funding to 52 projects. This year, not only did we see an increase in the amount of funding we awarded by 49%, but we also saw an increase in the number of applications received from the previous year by 123%. And I think it's really important to note that of the total number of applications received this year, 28% of those applicants had never previously applied for an award. So over the past 5 years, in total, we've awarded €46,104 across 32 hospital settings. And then we're now just going to take a short break, and I've got about a 1-minute video just to continue to highlight some of the beautiful initiatives coming through. So what did we do differently this year? Well, I touched on my previous slide that we saw an increase in the number of applications we received from the previous year, and that increase was 123%. So I just identified the 3 areas of improvement we as a team took to continue to develop the HFHQI Awards. So like previous years, we still delivered our support sessions, and we delivered 3 support sessions, 1 each month in May, June and July. And these were delivered in partnership with the HFH team and the HSE QPS team. However, what we did differently is that we aim to continue to engage and inspire new applicants by inviting a previous QI awardee to come, present their project and speak to their learnings and share their experience. Having evaluated the effectiveness of the support sessions, we know that of everyone who attended a support session and then subsequently submitted an application, all of those were awarded funding for their QI project. Again, we tried to find a balance by having HSA QPS team speak to QI approaches and methods and try and demystify some of those and alleviate any fears over potential applicants who may never have done a QI project before. And then obviously having the previous QI awardee speak to their award was really that inspirational piece that we wanted to include. Next, we introduced our HFHQI project clinics. This was a new addition to this year, and it really provided applicants the opportunity to have a session one-to-one. So we realized that not everyone would feel appropriate or comfortable speaking about their idea or their initiative within a group facilitated situation like the support sessions. So we facilitated those one-to-one sessions. And again, having evaluated those, we understand the effectiveness of them. So out of everyone who attended who subsequently submitted an application, 100% received funding. And actually those who attended a clinic on average scored higher than those who didn't attend. And interestingly, the top 5 highest scoring applications were by applicants who attended a support session. And then finally, we just reviewed our application form and the ways that individuals could apply for a HFHQI award, with the aim and the idea that we wanted to consolidate all key information in one place and make it easier for individuals to apply. And then lastly, I'm going to run through the slide because I'm sure I'm way over time, but I just wanted to share what we're planning to do in the coming year. So over the past 5 years, we've identified trends in applications, and these trends indicate potentially a wider need for standardized projects across Ireland and nationwide. With this in mind, we went through a process to identify key projects that we feel would be beneficial for upscaling. Now, listed here and shown here on this slide is 4 beautiful projects, all who received funding through the QI Awards. So firstly, to the far left, the box with the image, this is the Soothing Melodies project, which was submitted by Connolly Hospital and led by Rachel McEwen, End of Life Care Coordinator. And the aim of this project was to provide each acute area access to Bluetooth speakers and radios, so patients who were at end of life and their families could create a beautiful setting, one filled with homely sounds and filled with music, memories and love. As we know, research shows the power of sound and music. So we thought this would be a beautiful initiative to continue to support. Next, we have the Together in Sympathy book, which was led by Edel, End of Life Coordinator at Mercy. I'm not going to say too much about this project because we're fortunate to have Edel here today, which she will be speaking more about her project. So I'll go on to the third project, which is the Swallowing and Mouth Care leaflet. This project developed an accessible information booklet regarding the management of swallowing and oral hygiene for those with a life-limiting illness in Naas General Hospital. And having done a literature review and a review of current resources, there doesn't seem to be current offering of this literature available. And our last project is the Care After Death checklist, which I've already spoken to about previously. So I hope that's given you a brief overview of the QI Awards, some of the beautiful initiatives coming through. And now I'm delighted to pass you over to Edel O'Neill, End of Life Care Coordinator at Mercy University Hospital.
Thank you very much, Lucy, and thank you all for the opportunity to introduce you to our Quality Improvement Project and QI Award from the IHF for End of Life Care at the Mercy University Hospital in Cork. As end-of-life care coordinator, I'm constantly trying to improve and enhance the care that we provide to patients and their families at end of life. The process of sending a sympathy card to bereaved families following the death of their loved one from the ward where they died was already in place throughout the hospital when I started in my role as coordinator. However, the recording of patients' details, including the date of death and the next of kin contact details, to facilitate the sending of a sympathy card, this varied from ward to ward in the context of where it was recorded. So it wasn't easily identifiable book. When I went to different wards, I felt in some it was a notebook, some it would have been a refilled small pad, or it might have been a hardback notebook. I knew I wanted to improve this process, but was unsure how I could do it or what was achievable. As a coordinator new to the role, I took every opportunity to avail of training and support to help me in achieving quality improvement initiatives. The IHF provided a support session which I felt further motivated me to commence this process. I highlighted what I'd like to improve at one of these sessions, and it was the best thing that I did. I went from uncertainty on how I would do it to gaining clarification on how to start and who to engage with for my QI project. So I wanted to develop a standardised book to respectfully record patients' deaths and to document the sending of each sympathy card sent. I knew that the process could be improved and carried out in a compassionate manner, whilst also supporting and acknowledging the extraordinary care that our staff provide to patients and to families at end of life. Our project always was aimed towards this, achieving the quality standards for end-of-life care in hospitals. And as a coordinator, this is something that I strive towards in every aspect of my work. The hospital was already sending a sympathy card, and this was standard 1.11, that a sympathy card is sent to bereaved families within 2 weeks of the person's death. This is something that we were achieving, but something again that I just wanted to improve upon or enhance. The second one here, the staff standard 2.5. So staff support services relating to end-of-life care is something that we're very passionate about and something that we want to provide to our staff. Staff continue to work in exceptional circumstances and to acknowledge their work in a compassionate manner. Our aim was to foster a supportive work environment and to enhance staff well-being while at work. We do acknowledge that each staff takes responsibility for their own self-care, but we addressed and we hoped that we addressed this in the book by using imaginative and inspirational quotes and imagery throughout the book. And our aim here was to evoke gratitude and promote the importance of self-care for staff. The third standard was the family, and that's standard 4.6. The family members are treated with compassion and in a caring manner. And we hope to achieve this in what we were doing with the book by sending our sympathy card. And of course, our patient, that we continue to honour the patient that we've cared for. For our project aim, we aimed that by December 2022, we were hopeful that we would have introduced a standardised resource for staff where patient deaths are recorded, ensuring that end-of-life care is central to the care that we provide here in the hospital. A book that records those that have died, whilst acknowledging the care and compassion that our staff provide. The recording of patients' deaths also enables us to document each sympathy card sent to bereaved families, and therefore continuing our commitment to deliver compassionate care to families following the death of a loved one. While we aimed for December 2022, in reality it was May 2023 when we actually launched the book. The delay of this was due to circumstances just in the hospital, and we wanted to choose the right time when we were going to introduce the book, and it was really important for us to get full engagement for the use of the book. So for our project plan, as end-of-life care coordinator, I was the project lead, and my first task was to identify a ward to engage with and to involve the staff in designing the book. It was of utmost importance to involve all staff, including CNM2, CNM1, staff nurses, clerical, HCA, chaplaincy. The list is endless because we wanted to involve everybody who's involved with end-of-life care. And that is everybody within our hospital, to discuss the requirements for the book and to obtain feedback. We informed quality and risk also of our QI project and the process that we wanted to be involved with, and GDPR. We raised this at our end of life committee meeting, and we also then set about designing the book. So I wanted to ensure for the design and content and for the book that we wanted to ensure that each person involved had their say in the development of the book. I didn't want anybody to feel that it was me wanting to change something on my own. This was a collective process, and I wanted everyone to feel that they were an active participant in each step. There were definitely difficulties with this. Getting to meet staff from the wards was challenging at times due to ward acuity or staffing levels. However, the meetings continued, and who could attend did. And any emails then were circulated with progress, and agreement was reached on all aspects of the book by having continued communication with everybody involved in the book. The board CNM2 would relay to the staff any decisions in the book and would report back any suggestions from the staff on the ward. Our sympathy card, which you had seen just at the start of this presentation, was previously designed by one of our registered nurses. We were absolutely privileged to have a bespoke sympathy card designed for us here in the hospital. The butterfly is a recognised symbol of rebirth due to its metamorphosis process from caterpillar to butterfly, and it represents gentleness and gracefulness. And the significance of the butterfly is life after death. We also chose the purple butterfly. Purple butterflies are rare, indicating that it isn't something that happens regularly. Each death is individual and significant to the family and the staff caring for them. We chose to continue this design for our book. We didn't want it to feel clinical. We wanted to have a warmth about it and for it to be clearly identifiable on the wards. We had a vision and we just wanted to get this out on paper. For the content, we identified what was required for the book. The design of the book was in our heads, and we knew what we wanted, and we wanted what feel we wanted to get from it. We engaged with our GDPR to ensure that we weren't breaching any data regulations in relation to documentation. We did meet a stumbling block here in relation to what we could record in the book. We thought that we could record the patient's name, date of death, and next of kin details to send the sympathy card. However, when discussed with GDPR, they advised next of kin's contact details should not be recorded, and for the next of kin's details to be sourced through our IPMS system and through the deceased patient's regional identifiable number. We also had a lot of sharing of knowledge from previous well-known projects, and to incorporate this quality was just fabulous to get engagement from staff and to have this in the development of the book. In relation to resources, we had scheduled many meetings with ward staff, chaplaincy, design expertise, and communicated via email and telephone consultations with our printing and design company. Again, I found this difficult. At times, it was hard to portray what we wanted and what we envisaged for the book, and to get this across, through emails or through telephone conversations. There's nothing like having somebody next to you and to show you what you want and what you wanted from the feel of the book. However, through sending of samples back and forth to the design company, we agreed unanimously on the book, and it was absolutely wonderful once we got that feeling and had the final product in our hands. With regard to our budget, we didn't have a budget and we didn't know how much it was going to cost, but we were absolutely thrilled and very, very fortunate to have met with our design company and our printing company here in Cork. And they were very generous of their expertise and their time, and they did not charge us for this. And this is something that we're so grateful for, and that actually helped us again in, I suppose everybody was coming together. We all had one vision, and to think that this printing company would give us this time and their own time for the design was invaluable. So this is our final product, and the title of the book is Together in Sympathy. Again, we weren't sure what title we would use for the book, and collectively we chose the title Together in Sympathy. we wanted to convey to all staff and bereaved families our compassion at this time. The colours and the tone of the book were chosen carefully to evoke a sense of warmth and compassion. And even where we could, we were just discussing where would we put the title of the book? Would it be at the side, at the top? There was tremendous discussions in relation to the title and where it would be in the book. So I'm just going to show you here. This is the first introduction of the book and what it is for. Again, we have the imagery from our very, very talented registered nurse working here in the Mercy. And the time that we had spent choosing the colour of the pages and the font, it was chosen very carefully so that we wouldn't have a clinical feel about it. So I'm just going to go on to the next slide and just show you a little clip on, if we could just press play on that, please. It's just a little introduction to the book, and there's no retention under GDPR applies to this, as the data is contained within the book is only of the deceased. However, it is good practice to have a period of retention defined. So we agreed that once the book was full, it would be stored for a period of 6 weeks and that all staff would be able to view it. And again, here it's just an image of the inner aspect of the book where we record our patients' details. And again, we have no contact details for our next of kin. That's sourced through our IPMS system. So we continue to receive very positive feedback from bereaved families on receipt of sympathy cards sent from the ward where their loved one died. Staff, when introduced to the book, all welcomed the change and the improvement, and they were delighted to see the involvement from staff in the development of the book and commented on its content and its feel. And we were thrilled with that because it was something that we as a ward and as a hospital, we wanted to spread this to everybody across the hospital, to positively influence our staff by showing appreciation and gratitude in this book. It aims to further support all staff to confirm for themselves that they're doing their best and they know that the care that they provide at end of life is acknowledged. Thank you very much.
That's great. Thank you so much, Edel. And we are now going to have our panelists rejoin us. So Alice and Lucy are back on again too. So we put in the chat there, if you have any comments or questions, anything you'd like to ask the panel, please put it in the chat. I know there's been a couple of technical challenges for people. So apologies if you haven't been able to access the slides or the videos, but we will be sharing them afterwards and you'll get a notification of that. We'll have that on our directorate website and also available on YouTube. So if you'd like to watch them back later and see a copy of the slides themselves, they will be available to you. So I suppose going to our panel, Alice, coming to you first. You know, the QI Awards theme is fantastic. And for people who have joined us today and might be interested in applying, do you need to apply through an end-of-life care coordinator, or can anybody apply? And why should somebody apply? Is there something, you know, Alice has gone through it, or sorry, Lucy has gone through a little bit more about how the award scheme works, but what can somebody expect from the awards themselves by applying?
Brilliant. Thank you so much, actually, for picking that up, Roisin. So, yeah, one thing that I wanted to say, and I didn't, so we work obviously in partnership with the HSE, but actually the partnership that we've had with the QPS team over the last couple of years, but particularly at the moment, is brilliant. So just, I should have mentioned that in my slide, so I just wanted to say that here now. So in almost all hospitals across the country, basically any hospital where end of life is occurring, there is an end of life committee. And that committee is made up of members of the multidisciplinary team who are dedicated and passionate about improving end of life care and working towards those end of life standards, quality standards. Additionally, now we have 20 end of life coordinators working across 30 hospitals. So again, there's a really good representation there of potentially a coordinator being in your hospital. But what we wanted was for any member of staff from any team or department within a hospital to be able to submit a QI award. And really the rationale for that is because everyone, and I know it came up, you know, we asked the question earlier and people were putting it in the comments, it is everyone's business. Everyone can make improvements to the service they deliver, as well as maybe the wider services of the hospital. So there are so many great ideas coming out from across the board, across the teams, across the levels within a hospital. And we didn't want this to be hierarchical. We wanted it to really recognize the good ideas that people have and then help them work through them. What we encourage is that you talk, and as Edel spoke to, you need to talk to everybody. So talk to your end of life coordinator if you have one, talk to your committee, talk to the other teams, talk to anyone who's going to be impacted, engaged, and part of this project. And the earlier you do that, the better. But no, the idea, the work, and the passion and commitment can come from any member of staff, and we really encourage them to come from a wider representation of staff, because that's where we get the richness of different ideas and slight nuances on ideas where people see different things that they need. And then I think there was maybe a second part of the question that I'm not sure if I've answered.
Yeah. No, that's great, Alice. And you're absolutely right. I mean, I know I'm kind of an insider speaking here, but coming from not just end of life care coordinators, but from people in a number of in the hospitals. It's great to see the diversity, and even to see that spark, that seed of thought blossom as from talking with the people that are working in end of life care in the hospitals has really grown through the QI word scheme. So I suppose the second part of my question, Alice, was when people apply for a Hospice Friendly Hospitals QI award, should will they have from it, apart from obviously the financial support? And again, Lucy covered some of these already, but there's a range of support offerings is what I'm taking from the presentation.
Yeah, absolutely. Both. So we're trying to offer support from our side, both to help you apply and then after you apply if you're awarded the funding. But actually, we're also really trying to engage in some of the more formal QI education offerings as well that are being provided through the QPS team and through HSE Land. And I think that's giving an added dimension this year, which is really beneficial both to our team and to the awardees and to the staff in the hospital. So there's quite a lot of support on offer. And what I would say is to anyone who is thinking, I have an idea, but I don't know if it's good enough or if I should even say it out loud, it's like you don't even have to come to a support session. You can contact Lucy and I on the side. We'd be happy to talk it through. We'd be happy to help you navigate that process, because there are so many good ideas, but it does take a lot of passion, a lot of energy, and like Edel was speaking to there, like a lot of time, like to go around to everybody, to get everybody on board, to encourage people to see what your vision might be or what the impact could be. That does take time, but what we see again and again across our programs within HFH is that all that time is really worth it. These are change projects, these are quality improvement projects, which means that they do take time, but then the results, the learning, the shared ownership, the shared passion, it's worth it, and we see that.
Yeah, and actually, Edel, coming to your beautiful presentation, and then somebody commented, Maria commented, beautiful initiative in the Mercy. Well done, Edel and team.
Yeah.
How did you engage? You mentioned engaging with a range of stakeholders, and there is such a range, and the challenges you had around engaging with them even virtually and getting people out of meeting, to meet with you or to speak with you. How did you get that sense of ownership? This is kind of a golden nugget we're always looking for in QI, not just having staff participate, but feeling they're really part of it. And how did you do that in the Mercy?
I think when I had started with it, Roisin, it was to have a presence and to meet with people and to actually engage with them. And it was from the very, very start, I asked them, how did they think that it was working? Did they think that there was something could be improved upon? What did they think could be improved upon? And how could we do it together? And it was getting that feedback, but it wasn't just while I identified a pilot ward to actually do the book and to design the book. It was any opportunity I met with people, I asked them, what's happening? What do you think could be done? Who do you think could be involved? And I asked everybody across the board. And I think it was from that the feedback that I got from people. Some people didn't think that they should be involved, whereas I said, yes, you are. You meet with families, you meet with bereaved families, you meet with patients. So it is everybody that is involved in the hospital. And I think initially, like that, there was a bit of hesitancy from people saying that has nothing really to do with me, but it actually did. And it really made it wonderful, you know, when people felt that what they were saying, that we took that on board and we took everybody's feedback, no matter who you were. And then when we actually had the end product to show them that their input made an impact, and, you know, even from, as I was saying, the font, the color, the images, to have our staff nurse design the content, you know, and our imagery, it was wonderful. And I think that buy-in was fantastic. Then we got that drive from everybody because everybody was involved in the book. It wasn't my book, it was the hospital's book. And I think, you know, from that, nobody was left out. And it was very important for me that nobody was left out and everybody was able to share their comments. And we took time with it. We reviewed it, you know, we went back, we reviewed it again and again and again. And eventually we got the final product that we felt was the vision that we had from day one.
And that thought, that care really exudes from it, Edel, you know, and even the beautiful artwork that was done locally, it has such a sense of community about it as well, that I think so many people can connect with. It's a really beautiful project.
Thank you. We were very,
Lucy,
very fortunate.
Yeah, absolutely. I think we can all learn from it. That's one that I'd love to see, you know, the ones that Lucy spoke about, scaling and replicating and spreading the learning and scaling. They're again more golden nuggets of what we're looking for in QI, being able to scale and spread that knowledge. And Lucy, coming back to you on the scaling of the projects, that's new for this year. So, you know, from what you've seen of the QI award scheme, you know, how it was done last year, how it's being done this year, how has the overall process evolved, and how do you feel that the process itself is improving?
Yeah, thanks, Roisin. Just to touch on your first part about scalability, I guess we have seen projects scaled up previously. Some of you might remember the end-of-life keepsake pouch. So that was an initiative from Portuguese University Hospital. And that was, again, a very simple initiative that we could see improvement within end-of-life care. And it symbolized the need nationally. So that was one project that we'd had previously identified, but I guess we've never been very systematic in our approach. Whereas this year we very much, you know, we talk about quality improvements. We've been very reflective in how we can embed quality improvements within the Quality Improvement Awards. So how are we doing it? How can we improve? What changes do we need to make? So very much the focus this year was, okay, well, we want to have more applications. We want applicants to feel supported throughout that process. And again, we want a range from disciplinaries. We'd love from a range of different hospitals. I think it's important to note that we don't have a limit on the number of applications a hospital can make, because we don't want to limit. If people have ideas and they've got passion, we want them to be able to be supported. We want those initiatives coming through. So we had, I know I mentioned it, I'm going to keep on mentioning it, we had a 123% increase this year, which was fantastic to see. And I do think that's in terms of the support sessions that were delivered in partnership with QPS team, again, giving that structure to, this is what QI is, let's break it down. These are some of the methods that we can use, and that can be fed into our wider understanding of training education around QI, and then the introduction of previous QI awardees, because that's where the passion's coming from, and also the learning. Because we, from a HFH team perspective, can talk about what we want to see in an application, but giving individuals the platform to share, well, this is how I approached it. You know, Edel spoke about how she brought in that stakeholder engagement, how you build those relationships, and how you take a beautiful idea into a full QI project. And it's definitely something next year we'll be doing support sessions. We will be inviting QI awardees to speak to their experience, maybe even having more QIs awardees speaking to their experience, because that's where we know, like you say, the golden nuggets are. And I guess continuing with the HFH QI project clinics, we know that they were also beneficial from the statistics, and moving forward into scalability, we will be upscaling those 4 projects, and we can continue to update people on the developments of those. I know after the announcement at the Acute Network meeting, there was a lot of interest in the projects. So now it's just making sure we set aside time to get those to the next stage. But we're delighted to have Edel's project, Rebecca's project, NACE's project, and also the Soothing Melodies project. We've got too many projects we want to support.
Yeah, as well. And to be honest, from our perspective, you know, it's helping to build QI capabilities and help to demystify QI, I think, too. So we're definitely seeing the benefits of the amount of work you're doing on this as well. We're kind of rolling in pretty quickly to our finish for the session for today. So unless there's any other final questions in our chat box, you can send them privately to us or put it in for everybody. I will hand you over to John, who will wrap up our session.
Thanks, Roisin, and well done, everyone. Just to go back to our chat box there, I think the theme certainly coming through has been the importance of everyone. So from Vivian Roach Fahy, there was end of life care is everyone's business, and from Ciara McLaughlin, everyone can have an impact. And I think I was really impressed, you know, listening to Edel's project. It's just such a great example of co-production, co-creation with everybody, and I love it. It's not just inviting people; it's going out and really you know, engaging with them and relating to them and making sure they come along. So well done, guys. I think that's a fantastic piece of work, and really great to hear about it all today. And like Roisin said, we will have the video and slides will be available for anybody who missed out on content today, and there will be links there as well on the website afterwards. So yeah, please do follow us on social media, engage on Twitter. You can watch back on the YouTube channel, and we're on LinkedIn as well. And just a reminder for your diaries for 2 weeks' time, if you want to join us for our next QPS Talk Time, that's going to be looking at stroke care, so using QI to improve stroke care on the 21st of November. And you can join us then. We look forward to seeing you. And so thanks again to everybody in the background. Thank you, Roisin. Thank you to all our panelists. And thanks to Chris and Maureen and Shima and all the people who are in the background that make this all flow so seamlessly. So we do want to say thank you to everybody. You can contact Chris if you want to be included on our QPS Talk Time invitation list. And we'll see you in 2 weeks' time.